Greetings everyone. Today, we're delving into the world of a medication known as Dulaglutide, commonly recognized by its brand name Trulicity. As with all our discussions, this is intended for educational purposes. If you have health-related questions or concerns, always seek advice from a medical professional. Description: Dulaglutide, marketed under the brand name Trulicity, is a medication available in injectable form. It falls under the class of GLP-1 receptor agonists. Its primary function is to assist the pancreas in producing insulin when blood sugar levels are high and to slow down digestion to reduce glucose production by the liver. Initially approved by the FDA in 2014, it's predominantly prescribed for type 2 diabetes management alongside diet and exercise. Moreover, it aids in weight management by promoting feelings of fullness and reducing appetite. Dulaglutide has also shown efficacy in reducing the risk of major adverse cardiovascular events in individuals with type 2 diabetes and established cardiovascular disease. Warnings: Dulaglutide carries specific precautions. It's not intended for use in individuals with type 1 diabetes. Additionally, those with a history of severe gastrointestinal disease should use it cautiously. Individuals with a family or personal history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2 should avoid using Dulaglutide due to its potential association with thyroid tumors. Before taking this medicine. Before initiating Dulaglutide treatment, several factors warrant consideration. Inform your healthcare provider of any allergies you may have, particularly to the drug itself. Since Dulaglutide can affect gastrointestinal function, individuals with a history of gastroparesis should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood sugar levels is advised for those with diabetes or at risk of diabetes. You should not use Dulaglutide if you or your family members have a history of medullary thyroid carcinoma or if you have multiple endocrine neoplasia syndrome type 2. It's also important to inform your doctor if you have or have had problems with your pancreas, kidneys, liver, or stomach. Before starting the medication, inform your doctor if you have ever had severe stomach problems, if you have or have had bleeding problems, or if you are scheduled for surgery or certain X-ray procedures with injection of dye, as you might need to stop taking Dulaglutide for a short time. Side effects: As with any medication, Dulaglutide can have side effects. Some individuals may experience gastrointestinal symptoms such as nausea, vomiting, diarrhea, or constipation. Additionally, there's a potential for injection site reactions, including redness, itching, or swelling. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Furthermore, there's a risk of pancreatitis, a potentially severe and life-threatening inflammation of the pancreas, associated with the use of Dulaglutide. Symptoms may include severe abdominal pain that may radiate to the back, with or without vomiting. If you experience these symptoms, seek medical attention promptly. Interactions: Dulaglutide may interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Dosage: Adhering to the correct dosage is crucial for the effectiveness of Dulaglutide. Always follow your doctor's recommendations when using this medication. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The typical starting dose of Dulaglutide for most adults with type 2 diabetes is 0.75 mg injected subcutaneously once weekly. Depending on your response to the medication and based on your doctor's advice, the dose may be increased to 1.5 mg once weekly. It's important to note that Dulaglutide is not recommended for individuals with a history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Always ensure you're using the correct dose and never adjust your dosage without consulting your healthcare provider. Avoid: While using Dulaglutide, it's essential to maintain proper injection techniques and to rotate injection sites to minimize the risk of injection site reactions. As with many medications, it's recommended to avoid alcohol consumption, as it can exacerbate certain side effects. FAQ: Many wonder about the age restrictions for Dulaglutide. Currently, its safety and effectiveness in individuals younger than 18 have not been well established. It's advisable to consult with a healthcare provider for any specific queries related to this medication. Closing: That concludes our overview of Dulaglutide. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.